Hello, everybody. Welcome back into the DM Rehab channel. So, I know it's been a while, but most of that is due to corporate bullshit, really. So, that can be described another time, but I'm back to doing kind of what I want to do. And as you can see in the name of the title, this is going to be an emphasis for you golfers again on coming back to golf after a gallbladder surgery. So, I had laparoscopic gallbladder surgery done on March 13th. It is April 23rd now, so I'm fully back to playing golf now. But I was doing a lot of research beforehand, and there wasn't really anything that told me or any other golfers other than some Reddit channels, and honestly, that was about it. That's where I got some of my information from. It was Reddit, and that's not the highest quality evidence-based research there. All I got from my surgeon on being able to play was he asked how old I was, my physical fitness level, and he said, 2 weeks. So I took him at his word, and you guys are going to see when I got back to playing golf. But I wanted to give all of you golfers, because this is such a common procedure, I wanted to give people a bit of a roadmap on how to get back to golf. So if you are going through a laparoscopic gallbladder procedure anytime in the near future, please subscribe to the channel and reach out in the comments, and I will send you a breakdown and overall program that's going to get you back to golf the quickest. Now, I am a TPI, Titleist Performance Institute expert, level 1 and level 2 medical. I am a doctor of physical therapy, so I do have the grounds to give you this information. That being said, this is all educational only, and for additional education on this and for any other information, you should reach out to your doctor, or if you would like to become one of my patients, you can do that as well. But this video for my non-patients that are watching this is strictly educational. So I don't get in trouble, basically. All right. So let's dive into it. What we're going to do is I'm going to be breaking this down through basically the 2 weeks. So spoiler, I do get back to golf in 2 weeks. And I'm going to be breaking it down by a couple different days and I'm just going to be breaking down my experience and how I did kind of each day going forward. Not each day, but some of the significant landmark days that I accomplished with different goals. So let's get right into it. So here we are, post-op day 1. So first day after surgery. I'm going to show you the video, and all that we're working on here is it's just extension, posture, general movement. So you don't have to worry about anything else at this point. You don't have to be a hero. It's post-op day 1. Let's go back to that. It's the first day after surgery. You're not going to be playing golf after this. You're not going to get back to golf day 1, but you can certainly set yourself back by overdoing it. And this is going to be a theme throughout. So your age, your general fitness level, your knowledge of pain and what your body can tolerate accurately is also going to be playing into when you can get back to golf. So here we are, day 1. All I'm focusing on is standing up nice and tall. As you can see here, it's not comfortable, but it feels okay. And what I noticed those first 3 days especially is my body wanted to be more bent forward. Your body wants to take some stress off of those core muscles. So the more you can try and stand up nice and tall, stay moving, try not to be on the couch. It's fine to rest and do what you got to do those first couple of days, but try and push yourself a little bit. I promise you that it is going to help you down the road. All right, so that's day 1. Don't be a hero. Just get up, move, work on your posture, stand up tall, okay? So let that play out. Get right into post-op day 2. So 2 days after surgery. All we're doing here is I'm just on a treadmill. I'm walking. I believe I'm at 1 mile an hour here. It's nothing crazy. Again, emphasis is on posture, standing up tall as you're walking. And now, it depends how you feel. Again, I'm a medical professional. I'm a physical therapist. I specialize in golfers, so I know about the body. I know what I can tolerate. I know what pain is tolerable for me. As I said earlier, if you have any questions, please reach out to me. I will more than glad to help you guys out. Again, I'll send you a roadmap if you do subscribe to the channel, and reach out in the comments. So day 2, working on a little bit of a longer walk, trying to get in some light aerobic exercise. And again, I'm walking pretty slow at this pace. It's only 1 mile an hour. I'm really not doing much here on post-op day 2. Okay. Now, post-op day 3, as you saw here, I'm able to bump up the treadmill from 1 to 2 miles an hour. And it doesn't seem like a lot. And that first day post-op, trying to do that, it was actually more uncomfortable than I thought. Just walking at this slow pace, harder than I thought it would be. All right. And even before we get fully into the third day, where I am doing better, I will say sleeping was really tough for me. I couldn't lay flat for the first 3 days. I had a ton of pain in that right upper quadrant area where I did get the gallbladder out. And just some quick additional info. I had 3 small incisions. I had one kind of right in the middle of my chest, almost kind of below your sternum. I had one at the belly button, and then 2 additional tiny holes to the right of the belly button. All right. And essentially what they do is they go in, they blow up the area, send some air in there. They kind of cauterize things a little bit to make things clear for them to get things out. And then they go around, if there's any adhesions, they'll take those off first, and then they'll get to the gallbladder. I don't know exactly how they do it, but they obviously they take it out. They separate it from your main bile duct there, and then they put the gallbladder in a little tiny bag and then pull it out through your belly button, basically. So that was the most pain I had of all the incisions, was that belly button one, because that is where they pull the gallbladder out. So it's a little bit bigger than the other 3. And if you do want to see a video of this, go on YouTube. There are videos of it. If I personally, again, because I'm a medical professional, I wanted to see what the surgery looked like, how it was going to be done, and what kind of I was in store for and what they'd be doing, because I like those kind of things. All right, so back to post-op day 3. Getting back to more of a normal walk. You'll see me moving here. Definitely at a brisker pace. Even this is still a slow walk for most people, most middle-aged adults. I'm 30 years old, so I like to think of myself as a young adult. But I'd say 2.5 miles an hour to 3 is closer to a brisk walk. And so here I'm still at a fairly slow walk on the treadmill, but it definitely feels a lot better. I'm standing up taller, and I'm feeling better at this point. So this 3 days afterwards, thumbs up, and I'm able to start putting here. So what putting is going to do is it's going to help you just a little bit work on some of those core muscles, not in a intrusive kind of way, but when I was putting, it definitely, you felt it. It was a little bit uncomfortable. And again, this is where you need to know what your pain levels are. My go-to for people is if it's worse than a 3 out of 10 pain, whether it's post-op after your surgery for this kind of surgery, if it's a shoulder issue, if it's a back issue, that's my go-to. If things are worse than that, then you're probably doing more harm than good. Again, it's good to push yourself to a point. I am not a physical therapist that is no pain, no game. That is a debunked theory. It is not correct. So if any PT tells you that, they're wrong, and you should probably see another one, to be honest. So I'm able to putt. I'm able to sink all 3 of these putts, and it felt good to be able to hit some putts. Works on your core a little bit, working on some of those lower back muscles, being in that putting posture, and it's just a nice way to progress yourself a little bit. So that's 3 days post-op. Next, working up to, I believe it's day 5. So I'm back in the clinic. I went to work. Let's see. This was my first day back at work, actually. So 5 days after surgery, I was back at work. Now, I do not have an incredibly intensive job as a physical therapist. I can switch things around. My patients were able to help me with things that needed to get moved. If I needed to move a table a little bit, know your limitations. Don't be lifting anything heavy that's probably more than 8 to 10 pounds at this point. You should not be lifting. And if there is any significant exertion, again, see how you're feeling. If you feel pain with it at this point, again, you can do more harm than you can do by really pushing it. All right. But at this point, kind of quarter swings, little chips. And next to this picture, I actually have a little bike in my clinic so that I was able to ride the bike as well. Again, just getting to some light activities. It was nice to be able to chip. Swing was okay, little quarter swings. Again, a little discomfort here, but it was okay. And I would say by day 5, I was able to lie flat, lay on my sides a little bit. Still couldn't really lay on my right side, but laying on my left side was getting better. Laying on my on my back flat was fine at this point. So I did do quite a bit better. I'd say that 4th day after surgery was when I really started to feel quite a bit better. Being back at work for a full 10-hour shift, I was tired, but it wasn't overkill. All right. So I'm going to say this multiple times. I've said it before. I'm going to say it probably multiple times after this. Know your body, know your limitations. Don't go back to work too soon, but it is okay to push yourself a little bit. All right. Again, know your body. Reach out with any questions that you have. Okay. So we'll keep on watching me chip a little bit. I think I have maybe one more chip there. And again, it felt good to just get back to a little bit of golf there, which is nice. All right. Now, I skip here a little bit. I don't know why. I thought I took a video of myself doing full swings at post-op day 8, 9, and 10. So I would say at post-op day 8, I was able to start taking full swings. Not 100% full swings, but actually getting the club back fully with some discomfort, but again, knowing what your limitations are. And I was probably taking 25% swings, and every day after that, I probably bumped up by 15% or so. So I'd say at about day 10, I was around taking 50% swings. I have a launch monitor in my clinic as well, so I was able to see what my speed was. I know the speed of my 7-iron. I swing that around. Once I'm loosened up, I'm swinging that between 75 and 80 miles an hour. And if you do happen to know your swing speeds, that's something that's going to be able to help you know kind of where you are on your timeline to actually returning and taking full swings. All right. Again, if you have questions on that, if you at least know your driver speed, I would be able to break those swing speeds down for you and tell you, based on your club, what you should be at before returning. I'd like you to be at around 90-95% of your normal swing speed before you were to get back out on the course. All right. So post-op day 14, I was at around 90%. So I was getting it up to 70 miles an hour with my 7-iron that I have there. So I was comfortable at this point. So this was actually day 13. Day 13, I was at 90% of my normal swing speed. I went to the range this day as well, just to see where I was at. I was outdoors taking swings. I was actually able to probably hit 75 balls, and I felt fine. I would say the driver did not get back to full capacity until probably 3 weeks, but everything else I felt totally fine with. And as you'll see, and what else you could do with this is, as you're progressing, probably post-op day 10 and on, is try and ramp up the intensity of what your aerobic exercise would be. So you're still not really lifting at this point. Even I wasn't really doing anything. I was doing light dumbbells, no more than 8 pounds, because I also like to lift, just working on biceps, triceps a little bit. Still don't want to do much with the core, because that is an area that's where they went through. You don't want to overburden yourself with your core. You don't want to do sit-ups, anything like that. But again, you can take this to your tolerance. I was able to get back on my Peloton, bump up the intensity, and still wasn't able to go all out yet. Couldn't really do the full sprints, but I was back to probably 85, 90% of what I would normally do on the Peloton at day 14. And as you can see, taking a full swing here. You can also see that I don't get it totally back on my backswing, just because there's a little hesitancy left there, but I could take a full swing, no problem. And then there I was back out on the golf course, actually on day 14. All right. So with that being said, that's what we're looking for in a laparoscopic gallbladder removal. Again, this is going to come down to your age. What's your physical fitness level? How well do you know your body? How well are you aware of your pain? These are things that you don't think are incredibly difficult to think about, but they're not super intuitive. Without being a medical professional, I'm not sure I would have been comfortable playing golf 2 weeks after surgery. No matter what surgery, especially when there's your core musculature involved. In a sport like golf that is core intensive, you need that control. So knowing what I know, I was able to get back in 2 weeks with what my doctor had to say. Granted, that was a guess. If you go out on Reddit, it's going to say 3 weeks at best. But like I said, I showed you what I was able to do playing golf at 2 weeks exactly. That was my goal, and that's what I did. So that's where we're at. That was my gallbladder recovery, and I think I did quite well with it. And again, I'll say it again, if you have any questions, reach out below. Make sure you subscribe to the channel. There's going to be more golf content going forward as I break away from kind of what the corporate world wants me to do, because that's another story. But there's going to be more golf content for you guys coming, I promise this time. And this is just a start. So again, subscribe to the channel. I will send you an outline. If you reach out, subscribe, you'll get an outline for how to return to golf after your gallbladder surgery, assuming it is a laparoscopic surgery, which is minimally invasive, and not an open surgery. That one would take a little bit longer if they did end up having to do that. Again, I'm here as a resource, strictly educational right now, but I can absolutely help you guys going forward. All right, so best of luck this golf season. It's the middle of April in the Northeast. I've played a few times now. Played 2 days ago and played quite well. So looking to drop the handicap, play well this year, and have a great time out on the golf course. So hope you guys do the same, and I will see you for more golf videos going forward. All right, see ya.